Overview: Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia, also referred to as low hemoglobin, can make you feel tired and weak. There are many forms of anemia, each which is its own cause. Anemia can be temporary or long-term and can range from mild to severe. In most cases, anemia has more than one cause. See your doctor if you suspect that you have anemia. It can be a warning sign of a serious illness. Treatments for anemia, which depend on the cause, range from taking supplements to having medical procedures. You might be able to prevent some types of anemia by eating a healthy, varied diet. Symptoms: Anemia signs and symptoms vary depending on the cause and severity of anemia. Depending on the causes of your anemia, you might have no symptoms. Signs and symptoms, if they occur, might include fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, and headaches. At first, anemia can be so mild that you don't notice it, but symptoms worsen as anemia worsens. When to see a doctor: Make an appointment with your doctor if you feel fatigued and you don't know why. Fatigue has many causes besides anemia, so don't assume that if you're tired you must be anemic. Some people learn that their hemoglobin is low, which indicates anemia, when they donate blood. If you are told that you can't donate because of low hemoglobin, make an appointment with your doctor. Causes: Anemia can be due to condition present at birth, congenital, or a condition you develop, acquired. Anemia occurs when your blood cells doesn't have enough red blood cells, your blood. This can happen if your body doesn't make enough red blood cells. Bleeding causes you to lose red blood cells more quickly than they can be replaced, or your body destroys red blood cells. What red blood cells do: Your body makes three types of blood cells: white blood cells to fight infection, platelets to help your blood clot, and red blood cells to carry oxygen from your lungs to the rest of your body and carbon dioxide from the body back to the lungs. Red blood cells contain hemoglobin, an iron-rich protein that gives blood its red color. Hemoglobin enables red blood cells to carry oxygen from your lungs to all parts of your body, and to carry carbon dioxide from the other parts of your body back to your lungs to be exhaled. Most blood cells, including red blood cells, are produced regularly in your bone marrow, a spongy material found within the cavities of many of your large bones. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate, and other nutrients from the food you eat. Causes of anemia. Different types of anemia have different causes. They include iron deficiency anemia. This is the most common type of anemia and is caused by a shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can't produce enough hemoglobin for red blood cells. Without iron supplementation, this type of anemia occurs in many pregnant women. It's also caused by blood loss, such as heavy menstrual bleeding, an ulcer in the stomach or small bowel, cancer of the large bowel, and regular use of some pain relievers that are available without prescription, especially aspirin, which can cause inflammation of the stomach lining, resulting in blood loss. It's important to determine the source of the iron deficiency to prevent recurring of the anemia. Vitamin deficiency anemia. Besides iron, your body needs folate and vitamin B12 to produce enough healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cell production. Some people who consume enough B12 aren't able to absorb the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia. Anemia of inflammation. Certain diseases such as cancer, HIV and AIDS, rheumatoid arthritis, kidney disease, Crohn's disease, and other acute or chronic inflammation diseases can interfere with the production of red blood cells. Aplastic anemia. This rare, life-threatening anemia occurs when your body doesn't produce enough red blood cells. Causes of aplastic anemia include infections, certain medicines, autoimmune diseases, and exposure to toxic chemicals. Anemias associated with bone marrow disease. A variety of diseases such as leukemia and myelofibrosis can cause anemia by affecting blood production in your bone marrow. The effects of these types of cancers and cancer-like disorders vary from mild to life-threatening. Hemolytic anemias. This group of anemias develops when red blood cells are destroyed faster than the bone marrow can replace them. Certain blood diseases increase red blood cell destruction. You can hear it in hemolytic anemia, or you can develop it later in life. Sickle cell anemia. This inherited and sometimes serious condition is an hemolytic anemia. It's caused by a defective form of hemoglobin that forces red blood cells to assume an abnormal crescent sickle shape. These irregular blood cells die prematurely, resulting in a chronic shortness of red blood cells. Risk factors. These factors place you at an increased risk of anemia. A diet lacking in certain vitamins and minerals. A diet consistently low in iron, vitamin B12, folate, and copper increases your risk of anemia. Intestinal disorders. Having an intestinal disorder that affects the absorption of nutrients in your small intestine, such as Crohn's disease and celiac disease, puts you at risk of anemia. Menstruation. In general, women who haven't had menopause have a greater risk of iron deficiency anemia than do men and postmenopausal women. Menstruation causes the loss of red blood cells. Pregnancy. Being pregnant and not taking a multivitamin with folic acid and iron increases your risk of anemia. Chronic conditions. If you have cancer, kidney failure, or another chronic condition, you could be at risk of anemia or chronic disease. These conditions can lead to a shortage of red blood cells. Slow chronic blood loss from an ulcer or other source within your body can deplete your body's store of iron, leading to iron deficiency anemia. Family history. If your family has a history of inherited anemia such as sickle cell anemia, you also might be at increased risk of the condition. Other factors. A history of certain infections, blood diseases, and autoimmune disorders can increase your risk of anemia. Alcoholism, exposure to toxic chemicals, and the use of some medications can affect red blood cell production and lead to anemia. Age. People over the age of 65 are at increased risk of anemia. Complications. Left untreated, anemia can cause many health problems such as extreme fatigue. Severe anemia can make you so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia can be more likely to have complications such as premature birth. Heart problems. Anemia can lead to a rapid or irregular heartbeat, arrhythmia. When you're anemic, your heart pumps more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Death. Some inherited anemias, such as sickle cell anemia, can lead to life-threatening complications. Losing a lot of blood quickly results in acute severe anemia and can be fatal. Among older people, anemia is associated with an increased risk of death. Prevention. Many types of anemia can be prevented, but you can avoid iron deficiency anemia and vitamin deficiency anemias by eating a diet that includes a variety of vitamins and minerals, including iron. Iron-rich foods include beef and other meats, beans, lentils, iron-fortified cereals, dark green leafy vegetables, and dried fruit. Folate. This nutrient and its synthetic form folic acid can be found in fruits and fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts, and enriched grain products such as bread, cereal, pasta, and rice. Vitamin B12. Foods rich in vitamin B12 include meat, dairy products, and fortified cereals and soy products. Vitamin C. Foods rich in vitamin C include citrus fruits and juices, peppers, broccoli, tomatoes, melons, and strawberries. These also help increase iron absorption. If you are concerned about getting enough vitamins and minerals from food, ask your doctor whether a multivitamin might help.